Ask Dr. P, providing innovative tips to stop pain and improve mobility and quality of life. For more information on equipment or devices demonstrated in this video, scroll to the video details below the video or put your mouse cursor in the upper right corner and click the circle. Shoulder pain and stiffness can be caused by several conditions. It's important to first understand shoulder anatomy and movement. This will help you target the right areas and choose the right exercises for your particular situation. The shoulder complex is tasked with moving the arm in all directions. This requires several moving and non-moving joints, several muscles, and the scapula. Let's take a look at the key parts of the shoulder.
Scapula, subscapularis tendon, glenohumeral joint, clavicle or collarbone, sternoclavicular joint, acromioclavicular joint, acromion, subacromial space a source of impingement of the supraspinatus tendon, and finally, infraspinatus tendon.
Injuries to shoulder tendons often result in scar tissue, which can interfere with proper movement. Apply low-level laser to your shoulder. Laser light in the red and infrared wavelengths accelerate healing by stimulating cells that repair tendons and by increasing circulation to the injury, resulting in more oxygen and nutrients delivered to the injured tissues. Introduce movement as pain improves. Apply pulsed electromagnetic field or pulsed EMF. This uses safe, low-frequency electromagnetic waves to penetrate deep into the joint and energize cell membranes of healing cells, increasing intramembrane transport of nutrients and waste products, which improves healing. Pulsed EMF also is known to improve microcirculation to tissues by declumping red blood cells, improving oxygen delivery and healing. If you have an old shoulder injury that is causing chronic stiffness and loss of mobility, you likely have scar tissue inside your shoulder joint capsule. Scar tissue typically thickens like a callus, rubbing against other structures whenever you raise and lower your arm. Shockwave uses high-energy sound waves that can disrupt and soften scar tissue. This improves shoulder joint range of motion and may reactivate healing of the old injury. Lastly, a red light therapy shoulder wrap uses red and infrared light energy to heal sprains and strains and alleviate pain and stiffness. After doing laser pulsed EMF and/or shockwave treatment on your shoulder, start rehabilitation exercises in this order. Get a light stick like a mop handle and grasp as shown. In this demo, my right shoulder is being mobilized by my left hand. Push the stick as shown and passively move the shoulder in internal, then external rotation. Increase force as you are able to increase joint range of motion. This is a good exercise for stiff or stuck shoulder joints. Next, hold the stick in front of you as shown. Raise it up slowly, then lower. Go a few degrees higher each time you raise it until you reach the max height your shoulder pain allows. Then move it from side to side, lowering it a few degrees each time until it is back in front of you. Use your good arm to pull and push the bad shoulder to its maximum range as you move the stick from side to side. Repeat. Shoulder impingement occurs when the arm is unable to fully raise due to an obstruction inside the glenohumeral joint. It may be an inflamed bursa or thickened ligaments and scar tissue. If this applies to you, try these exercises. Obtain a 10 to 20 pound dumbbell and chair and position yourself as shown. Relax your shoulder and let the weight traction the joint. Rock your body forward and back so that the weight moves up and down and side to side. After a few minutes, move your body to make the weight transcribe increasingly larger circles, small to large. Reverse directions, transcribing large circles gradually to smaller circles. Try not to recruit your shoulder muscles in the exercised shoulder. All the motion is from inertia generated from moving your body. If you have tenderness and perhaps a grinding sensation in your sternoclavicular joint, it may be stuck or out of place. In this case, do this exercise. The articulation of your collarbone and sternum is the inner margin of the raised bony bump. Position your arm as shown and give it a couple of gentle but firm taps with a closed fist. Next, do a couple of exaggerated swimmer strokes as shown. Palpate the sternoclavicular joint to see if it moves better and the grinding sensation is gone. Switch sides. This ensures both joints get exercised and hydrated to prevent future problems. It's a good idea to laser it afterwards to reduce any pain and inflammation. As your shoulder pain improves and tissues heal, do these exercises 2 to 3 times daily. Get a dumbbell weight. Start out with 2.5 pounds. Raise it to shoulder height at the 12 o'clock, 2 o'clock, 3 o'clock, 4 o'clock, and 5 or 6 o'clock angles. Do 5 repetitions for each angle. Don't do too fast. Lower the weight slowly. As your shoulder strength improves, increase the weight to 5 pounds. If you feel sore afterwards, apply a few minutes of laser. Exercise both sides for good measure. Do the following shoulder exercises daily for maintenance. They activate all the muscles involved in shoulder movement in all planes of motion. It's easy to go through the day without raising your arms above shoulder level, especially if you have a desk job. This lack of movement can cause the shoulder joint capsule to dry inside, leading to stiffness and even frozen shoulder. These exercises guard against this by ensuring your shoulder joints stay lubricated daily.